Hello, my name's Shane Robbins. I'm the superintendent of the Kershaw County School District, and I want to welcome everybody to this edition of the Supe Chat. Today I'm joined by Susan Wachowski, the CEO of the Community Medical Clinic of Kershaw County. And so we just want to talk a little bit about the partnership we have with the Community Medical Clinic. And I'll just start out, Susan, by asking, why is the partnership important?
So we have learned through doing our healthy learning through the community that the most important indicator for health is a high school diploma. Mm-hmm. And having discovered that, we wanted to know what was important and how we could partner with you and bring to you our resources to make that happen.
Yeah, very good. And so, when we talk about high school diploma, one of the things that, we struggle with and what creates an at-risk student for us is their attendance. And I think we have seen over the years that as you see an increased number of, both parents in the home working, single parent homes, it's very difficult sometimes for a parent to get their child in to have the appropriate level of health care that they need. And so therefore it creates an attendance issue with us.
Right, and so one of our main focuses in our strategies and the purpose for the Community Medical Clinic is access. Mm-hmm. So when we think about that mission, we went inward to the schools. So mm-hmm. how do we bring place-based care and access mm-hmm. for medical care in the school so we can help reduce those numbers of unexcused absence? So we put our thinking cap on and we said we were going to model a minute clinic. So we are not taking the role of the primary care provider. We are looking exactly at what takes a child out of the classroom. And sometimes what takes a child out of the classroom is headache, sinus infection, or how about just anxiety over testing?
Right.
So as we explore that, we could go ahead and see the child right there and get them right back to class. And this saves times for the parents, keeps the child in school. Our nurse practitioners can call in the prescription to the pharmacy, and then the parents can stop by the pharmacy and pick up the prescription and go ahead and start their child on that course of antibiotics or medicines so they can go to school the next day.
And I think it's important for our viewers to understand that, our approach at providing this clinic is a convenience. There's a convenience factor that's included in that. And so we know a lot of parents really struggle if they have to take off work to come, pick their child up and take them to the doctor. Some parents can't afford to do that. And so I hope that this route of providing health care minimizes and mitigates some of those issues for our parents. I really like the fact that we have looked at this, not basing it on necessarily it's not necessarily a poverty issue or a financial issue. It can be, but it's also a convenience issue, for our families. And so keeping those children in school where they're getting instruction versus the window time that it takes them to get to the doctor's office, especially for the rural part of our community, it's going to be really advantageous for the school district.
I know. I appreciate you saying that, Dr. Robbins. So as you look at it for your parents and the families that we serve, we look at it from the patients and the families we serve in our healthcare community. And so what that also does, not only convenience for the families and parents, this also helps the primary care provider, because the school excuse is needed, then the parent is waiting in a waiting room in a doctor's office, and then that backs up waiting time. So it really also helps with the primary care doctor's office and the emergency room. So you don't have an unnecessary emergency room visit or bill as well.
Yeah, that's a good point.
Dr. Robbins, we have an explainer video. Maybe we can go to that and it'll explain how a child can be registered at the School-Based Health Center.
Is your child a student at Camden, Lugoff-Elgin, or North Central High School? The Community Medical Clinic of Kershaw County is now offering a school-based health center in all Kershaw County high schools. It's like a minute clinic on campus. The school nurse can refer students to our health center, where our nurse practitioner can diagnose common illnesses, write prescriptions, and provide medical excuses. During each visit, we call the parents and, if necessary, their primary care provider to keep everyone in the loop on the student's care. These services are free to Kershaw County High School students. Enroll your child today to take advantage of the school-based health center. Forms can be found on our website at cmcofkc.org. The Community Medical Clinic of Kershaw County. Better health through better partnerships.
So as we progress through this, could you explain to the people watching how they would go about signing their child up to receive services from the school-based health clinic?
Right. So it's really easy. We have the wonderful cooperation, the office staff, really.
Yeah.
Isn't the offices what really runs those schools?
Yes, ma'am,
So,
they are.
A big shout out to all those folks that keep those schools running. But if you'll just go to the school and office, and they'll have the forms for you. Or if you like to go online and you don't have time to do that, you can go on our website, and I'm sure we'll go ahead and put a link up that will tell you how to do that. But I think what's important here too, if we could just stop a minute, what schools are these in?
Yeah, so right now, we started out with a pilot school at North Central High School, and I know we're probably relocating that one due to the tornado that hit the school, but that's obviously a primary focus for us to make sure that we don't lose those services and opportunities. But then we also have one at Lugoff-Elgin High School and one at Camden High School as well.
That's right. And because it's the furthest and rural, and it was one of the pilots, we also serve the middle school, the
Right.
North Central Middle School, but the only middle school. But we are thrilled to be in those high schools and working together to be able to provide that. And we even expanded a little bit with telehealth.
Yes, ma'am, we did.
Yeah.
But could you talk to our viewers a little bit about just the evolution of school-based health clinics and the school-based health centers in Kershaw County?
Sure. So everybody has resources that they bring to the community. It's not just always trying to tax, the resident or the resident asking for another fee. That we have a wonderful partner with the Department of Health and Human Services, and they did an economic scan, and there was all this data about, where was the greatest need in each of the 46 counties in our state. And for Kershaw County, it was in the North Central area. So with that funding, we went on up there, and we found that, if the high school diploma is the most important indicator for health, then we needed to be where children were. So we opened up our very first school-based health center back in 2015, and Mr. Branham and Miss Ham and Miss Montgomery and Mr. Dixon and Miss Pay, all up there, helped us go through, and we learned together on the best way to serve. And it was a wonderful experience for us. And what I've learned from Mr. Branham, and even in the most recent disaster that we had with the tornado, that we stay in the background and we're there for support. So we're not to take the place of primary care and pull a child out of class and be there all day. We're just to help them stay in class and get them back to class. So we're there very quietly trying to do our work and help the teacher. Right. So that's our role for doing that. And that's what we hope to do in Camden and Lugoff as well. And resources and people resources and labor are the most expensive, and now our new partner with MUSC is going to help us be a little bit more cost effective and reach more by telehealth.
Sure. So, you've probably heard the saying, it takes a village to raise a child. And, honestly, as a school district, we take that very seriously because for 180 days out of a calendar year, those children are with us 7.5 hours a day. And so when we're trying to provide the very best for our children, it is a team effort. It's not just the school and not just the community health center and not just the community. It's all of us working together. Hence, a village to raise a child. So just as a reminder, you want to sign your child up to participate in this. The best place to go is to the secretary in the front office. They are the keeper of all information for that location, and be more than happy to help you. So I think that's the first step, and we really encourage you to take that step and get your child enrolled.
Thank you, Dr. Robbins. That is key, because if your child is sick and you're not enrolled, and you come down to see us, we're going to have to turn you away until the paperwork
Right,
gets done.
right.
And so we're there. If you need us, we'll be there at registration. We're there at your rising freshman classes and open house and anything else that the staff and the principals at all of the schools want us to be there to help keep the children healthy, because we want that next generation to be well, and we want to be the best partner with the schools that we can be to help you reach your goals as well.
So I will tell you, as the superintendent, it is very important to me that we are a leader in what we're trying to accomplish in our school district. And partnerships like this are one of the things that just set Kershaw County apart, I think, from other counties in the state of South Carolina. And Ms. Susan, I can't thank you enough for your partnership with the community health clinics that we have established. And, like anything else, we will continue to evolve and grow and improve. And it takes a team effort to do those things. So we really do value and appreciate your partnership.
Thank you so much, and thank you for having me.
Thank you. Thanks for joining me today. And that's this edition of the Supe Chat with Dr. Robbins.